So, Lori, one of your issues is that you've got what they call subluxation. In other words, this bone is not sitting in the socket like it normally would. For most people, the muscles in the shoulder, the rotator cuff muscles, hold this bone in place. And when the muscles get very weak, it tends to sag out of the joint. So you can see on my skeleton that this gap here is somewhat similar to yours, where it's kind of sagged downward from the weight of the arm. So the idea with the positioning and the exercise is to keep this bone within its normal position. So the ligaments of the shoulder are not always getting pulled with the weight of the arm. One thing that we can do to help with that whole process and with your shoulder pain and the alignment of your shoulder is to put on kinesiotape. So I'm going to show you how to do that, and it'll be something that your family would do, and if they watch the tape, that'll help them say, okay, this is how you do this. And I'm going to do a very simple pattern today, just so that it makes it simple for your family to learn how to do that. Now, what I have right now is your arm in a very comfortable open, what's called an open pack position. In other words, the humerus is sitting in this joint in its nice natural position. And I've got your shoulder in a good location. Everything looks good right now. I'm basically going to be putting on a T pattern from here to here and from here to here. And I have two different colors, and the colors actually don't matter at all. So the way I'm going to do that is start the tape by tearing the corner and exposing about 1.5 inches to 2 inches. And this is going to be our anchor that's going to be right down here. So there's going to be an anchor right there. Now, I'm going to expose most of the tape, and I'm going to try to avoid touching the glue part of the tape as much as possible. Now, with this particular taping, I'm going to give a light stretch, probably about 25 to 50%. This would be 100% stretching as far as it possibly can. I don't want to do that, so it's just a light stretch, 25 to 50%, and I'm going to lay it down just like that. Go ahead and take your shirt away and look to your right. Now, what I'm doing there is just stretching all this skin in here, so when the anchor goes down, it'll be comfortable. And the next step is for me to rub it, and that activates the glue, which holds it in place. After I do this, most of my patients say that their shoulder feels like it's more supported. So what I'm giving you is kind of the feeling of an upward pull, kind of taking place of those muscles that do that. So that's step one. And I have it a little bit high. If I did this over again, I'd cut it about 1 inch shorter than this. So probably about from here to here with the two anchors with no stretch on it. And this is the working part right here. So that's part one. Part two, and I ran out of pink tape, your favorite. Your shoulder tends to move out of the socket forward because of your tight pec muscles and other muscles that are kind of moving the head of the humerus this way. We're going to reposition the humerus back this way into the socket where it belongs. And for me to do that, I'm doing the same strategy. I'm exposing some of the tape. And when your family does this, it's going to take them several times of practice. The first couple times may not work perfectly. But after, we'll practice with them and they'll get better at it. Now for this one, I'm getting the tape right there. So this bone is right there. So I'm sitting right on top of that bone right there. I'm exposing the tape, but not laying it down. And I'm holding on to the last 2 inches. And for this one, again, I'm doing a light stretch. This would be 100%. This would be nothing. I'm doing about 25 to 50%. And again, your family will have to practice to get a feeling for that. And I'm pulling it back like that. And the last part, last 2 inches, has no stretch on it. It just sits in there just like that. And when I was doing that, I had my hand here, and I was basically pushing that bone back into the socket fairly firmly, pulling back like this and getting it into its proper position. This will, a lot of my patients feel like this helps their shoulder feel more comfortable, feel like it's got better support, and just do better overall. I'm going to take your hand away. Now notice when I move your arm, I'm treating it as if it was an infant, and that's a general rule of holding the arm, is you pick up the arm as if it was a baby as opposed to the dirty diaper. So you're cradling underneath and coming like that. So that's what it looks like, a simple T like this and like this. That should feel better. Now, some therapists might use other patterns for kinesiotaping, but for your family, this is a nice, simple pattern, something that they can imitate really easily. Now, you can wear this in the shower. It can get wet. You would just pat it dry afterwards. This will be good for about 4 to 5 days, and then afterwards, probably in a shower, when you heat up the glue, have your family peel it off real gentle. And then maybe have it stay off for a day or two, let the skin breathe for a bit. If it was helpful, have the family repeat it. Now this kinesiotape comes in rolls of about 5.5 yards, and it costs around $13 for a roll, so it's not very expensive. So this was about $2 worth of tape, and if it helps you get a good night's sleep, then it's worth it. If the edge peels up, they can take scissors and just trim off the loose edge. If a whole, let's say a whole third of it peels up, then just take the whole thing off and start over. But again, I usually have people keep it on for about 4 or 5 days. A lot of people find this to be helpful. And if you have questions, you can ask you and your family can ask your therapist about that. Do you have any questions about that? Good. I think this is going to help.